Welcome back to our channel. Today, we're going to dive into a topic that affects millions of people worldwide: hepatitis B virus. We'll explore how you can get infected, the potential consequences, and most importantly, ways to prevent it. So, let's get started. Hepatitis B is a viral infection that primarily affects the liver. It is caused by the hepatitis B virus, which can be transmitted through various means. The most common routes of transmission include unprotected sexual contact. Engaging in unprotected sexual activities with an infected person can put you at risk of contracting hepatitis B. It is important to remember that the virus can be present in semen, vaginal fluids, and blood. Mother-to-child transmission. Hepatitis B can be passed from an infected mother to her baby during childbirth. However, this risk can be significantly reduced by administering a vaccine to the newborn within 24 hours of birth. Sharing of contaminated needles. Sharing needles, syringes, or other drug paraphernalia with an infected person can lead to the transmission of the virus. This is particularly relevant for individuals who use injected drugs. Contact with infected blood. Direct contact with infected blood, such as through needle stick injuries or accidental exposure in healthcare settings, can also result in hepatitis B infection. Unsafe medical procedures. In regions with limited healthcare resources, the improper sterilization of medical equipment or the use of contaminated needles during procedures can lead to the transmission of hepatitis B. And yes, kissing can potentially transmit hepatitis B, although the risk is generally low. Hepatitis B is a viral infection that primarily spreads through contact with infected blood or bodily fluids, such as semen, vaginal fluids, and blood. The virus can be present in saliva, especially if there are open sores, cuts, or bleeding gums in either person's mouth. Now that we understand how hepatitis B can be transmitted, let's discuss the potential consequences of infection. The initial symptoms of hepatitis B can be mild, similar to the flu, or they may not be noticeable at all. However, over time, the infection can progress and lead to more severe complications, including 1. Chronic hepatitis B. If the infection persists for more than 6 months, it is considered chronic. This can cause long-term liver inflammation, leading to liver damage, cirrhosis, and an increased risk of liver cancer. 2. Liver cirrhosis. Chronic hepatitis B can result in the formation of scar tissue in the liver, known as cirrhosis. This condition impairs liver function, causing symptoms like jaundice, fatigue, and fluid buildup in the abdomen. 3. Liver cancer. Individuals with chronic hepatitis B are at a higher risk of developing liver cancer, also known as hepatocellular carcinoma. Regular monitoring and appropriate medical interventions are crucial for early detection and treatment. Now, let's focus on prevention strategies to reduce the risk of hepatitis B infection. Tips and advice. The good news is that hepatitis B is preventable through various measures. Here are some key strategies to protect yourself and others. Vaccination. The hepatitis B vaccine is highly effective in preventing infection. It is usually given as a series of 3 shots and is recommended for all infants, children, and unvaccinated adults who may be at risk. Safe sexual practices. Practicing safe sex, such as using condoms and having a monogamous relationship with an uninfected partner, can significantly reduce the risk of hepatitis B transmission. Needle safety. Avoid sharing needles or other drug paraphernalia. If you use injected drugs, consider seeking support to quit or using sterile equipment each time. Proper medical procedures. Ensure that medical facilities follow strict infection control protocols, including proper sterilization of equipment and the use of disposable needles. Universal precautions. Healthcare workers should adhere to universal precautions, such as wearing gloves, when handling blood or bodily fluids to prevent accidental exposure. Hepatitis B is a serious viral infection that can lead to severe liver damage if left untreated. However, by understanding how it is transmitted and taking preventive measures, we can protect ourselves and others from this disease. Remember, vaccination is the best defense against hepatitis B. If you suspect you may have been exposed to the virus, seek medical advice immediately. Stay informed, stay safe, and let's work together to prevent the spread of hepatitis B. If you found this video helpful, don't forget to give it a thumbs up and share it with your friends and family. Subscribe to our channel for more informative content on health-related topics. Until next time, take care and stay healthy.